Assalamu alaikum dear students. Today we will discuss Human Immune System MCQs Part 2nd. Where does the major portion of antibody production occur? Option A, peripheral blood. Option B, bone marrow. Option C, thymus. And option D, lymph nodes. So the correct option is D, lymph nodes. In which of the following circumstances would the indirect Coombs test be employed? Option A, identification of the ABO blood groups. B, identification of cold reactant antibody. Option C, identification of an unexpected IgG antibodies. Option D, identification of hemolytic disease of the newborn. So the correct option is C, identification of unexpected IgG antibody. In an agglutination reaction, if cells are not centrifuge longed enough, which of the following might occur? Option A, false negative result. B, false positive result. C, no effect. And option D, slight effect but can be ignored. So the correct option is A, false negative result. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। Agglutination inhibition could best be used for which of the following types of antigens? Option A, large cellular antigens such as erythrocyte. B, soluble heptins. B, C, bacterial cells. And option D, antigen attached to latex particles. So the correct option is B, soluble heptin. Which of the following correctly describes reverse passive agglutination? Option A, it is a negative test. B, it can be used to detect autoimmune antibodies. And option C, it is used for identification of bacterial antigens. And option D, it is used to detect sensitization of red blood cells. So the correct option is C, it is used for identification of bacterial antigens. Reactions involved IgG may need be enhanced for which reason? Option A, it is only active at 25 degrees centigrade. B, it may be too small to produce lattice formation. Option C, it has only one antigen binding site. And option D, it is not able to produce visible in vitro agglutination. So the correct option is B, it may be too small to produce lattice formation. All of the following would be considered good quality control procedures except option A, storing reagents properly. B, standardizing temperature of reactions. C, allowing the reaction to go as long as possible. And option D, using monoclonal antibodies to avoid cross reactivity. So the correct option is C, allowing the reaction to go as long as possible. For which of the following test is a lack of agglutination a positive reaction? Option A, hemagglutination. B, passive agglutination. C, reverse passive agglutination. And option D, agglutination inhibition. So the correct option is D. Agglutination inhibition. A positive direct Coombs test could occur under which circumstances? Option A. Hemolytic disease of the newborn. B. Autoimmune hemolytic anemia. C. Antibodies to drugs that bind to the red blood cells. And option D. Any of the above. So the correct option is D. Any of the above. Which of the following statements applies to Proton's X-linked gamma-globulinemia? Option A. It typically appears in female. B. There is a lack of circulating CD19 positive B cells. And option C. T cells are abnormal. And option D. There is a lack of pre-B cells in the bone marrow. So the correct option is A. It typically appears in females. Which of the following plays an important role as an external defense mechanism? Option A. Phagocytosis. B. C-reactive protein. C. Lysozyme. And option D. Complement. So the correct option is C. Lysozyme. So this is very important MCQs. The process of inflammation is characterized by all of the following except option A. Increased blood supply to the area. B. Migration of white blood cells. C. Decreased capillary permeability. And option D. Appearance of acute phase reactant. So the correct option is C. Decreased capillary permeability. Immunofixation electrophoresis differs from immunoelectrophoresis in which way? Option A. Electrophoresis takes place after diffusion has occurred. Option B. Better separation of proteins with the same electrophoretic mobilities is obtained. Option C. The antibody is directly applied to the gel instead of placed in a throat. So the correct option is C. The antibody is directly applied to the gel instead of being placed in a throat. Which statement is true? Measurements of turbidity. Option A. It indicates the ratio of incident light to the transmitted light. Option B. Light haze is scattered at an angle is detected. So option C. It is recorded in units of relative light scattered. And option D. It is not affected by large particles falling out of the solution. So the correct option is A. It indicates the ratio of incident light to transmitted light. When soluble antigens diffuse in a gel that contains antibodies, in which zone does optimum precipitation occur? Option A. Prozone. B. Zone of equivalence. C. Post zone. And option D. Pre-zone. So the correct option is B. Zone of equivalence. Which of the following statements apply to rate of nephelometry? Option A. Readings are taken before equivalence is reached. Option B. It is more sensitive than turbidity. Option C. Measurements are time dependent. And option D. All of the above. So the correct option is D. All of the above. An employee who receives an accidental needle stick should immediately. Option A. Apply sodium hypochlorite to the area. Option A. Notify a supervisor. C. Receive HIV prophylaxis. And option D. Receive a hepatitis B booster shot. So the correct option is B. Notify a supervisor. Which of the following is characteristic of the endpoint method of RID. Option A, readings are taken before equivalence. B, concentration is directly in proportion to the square of the diameter. Option C, the diameter is plotted against the log of the concentration. And option D, it is primarily a qualitative rather than a quantitative method. So the correct option is B. Concentration is directly in proportion to the square of the diameter. In which zone might an antibody screening test be false negative? Option A, prozone. B, zone of equivalence. C, post zone. And option D, none of the above. So the correct option is A, prozone. Which might affect the outcome of immunodiffusion procedures? Option A, improper dilution of antigen in the wells. B, overfilling the wells. C, non-level incubation of plates. And option D, all of the above. So the correct option is D, all of the above. Which best describes the law of mass action? Option A, once antigen antibody binding takes place, it is irreversible. B, the equilibrium constant depends only on the forward reaction. Option C, the equilibrium constant is related to the strength of antigen antibody binding. And option D, if antibody has a high avidity, it will dissociate from antigen easily. So the correct option is C. The equilibrium constant is related to the strength of the antigen antibody binding. All of the following could be used to enhance an agglutination reaction except option A, increasing the viscosity of the medium. B, using albumin. Option C, increasing the ionic strength of the medium. And option D, centrifugation. So the correct option is C, increasing the ionic strength of the medium. So this is very important MCQs. Which of the following best describe the slide agglutination test for RF? Option A, it is specific for RA. Option B, a negative test rules out the possibility of RA. And option C, it is a sensitive screening tool. And option D, it detects IgG made against IgM. So the correct option is C, it is a sensitive screening tool. All of the following are characteristic of a good immunogen except option A, internal complexity. Option B, large molecular weight. C, the presence of numerous epitopes. And option D, found on host cell. So the correct option is D, found on host cells. Which of the following best describe a heptin? Option A, not able to react with antibody. B, antigenic only when coupled to a carrier. Option C, has multiple determinant sites. And option D, a large chemically complex molecule. So the correct option is B, antigenic only when coupled to a carrier. So enhancing phagocytosis by coating foreign particles with serum proteins is called option A, opsonization. B, agglutination. C, solubilization. And option D, chemotaxis. So the correct option is A, opsonization. Which of the following peripheral blood cells plays a key role in the killing of parasites? Option A, neutrophils. B, monocyte. C, lymphocyte. And option D, eosinophil. So the correct option is D, eosinophils. Which of the following can be attributed to Pasteur? Option A. Discovery of opsonins. B. Research on heptins. C. First attenuated vaccines. And option D. Discovery of the ABO blood groups. So the correct option is C. First attenuated vaccines. Jenner's work with cowpox, which provided immunity against smallpox, demonstrates which phenomena? Option A. Natural immunity. B. Attenuation of vaccine. Option C. Phagocytosis. And option D. Cross immunity. So the correct option is D. Cross immunity. Which antigens are found on the T cell subset known as helper? Option A. CD3. B. CD4. Option C. CD8. And option D. CD11. So the correct option is B. CD4. Where does the major portion of antibody production occur? Option A. Peripheral blood. B. Bone marrow. C. Thymus. And option D. Lymph nodes. So the correct option is D. Lymph nodes. When does genetic rearrangement for the coding of light chains take place? Option A. Before the pre-B cell stage. B. As the cell becomes an immature B cell. C. Not until the cell becomes a mature B cell. And option D. When the B cell becomes a plasma cell. So the correct option is B. As the cell becomes an immature B cell. Which of the following best describe the T cell receptor for antigen? Option A. It consists of IgM and IgD molecules. B. It is the same for all T cells. C. It is present in the double negative stage. And option D. Alpha and beta chains are unique for each antigen. So the correct option is D. Alpha and beta chains are unique for each antigen. A latex agglutination test for CRP, C-reactive protein, is run on a 12-year-old girl who has been ill for the past 5 days with an undiagnosed disease. The results are weakly reactive with the undiluted serum and negative for both the positive and negative controls. What should the technologist do next? Option A. Repeat the entire test. B. Report the results as indeterminate. Option C. Report the result as positive. And option D. Obtain a new sample. So the correct option is A. Repeat the entire test. Which of the following are characteristic of acute phase reactant? Option A. Rapid increase following infection. B. Enhancement of phagocytosis. C. Non-specific indicator of inflammation. Option D. All of the above. So the correct option is D. All of the above. The presence of normal flora act as a defense mechanism by which of the following means? Option A. Maintaining an acid environment. B. Competing with pathogens for nutrient. Option C. Keeping phagocytes in the area. And option D. Coating mucosal surfaces. So the correct option is B. Competing with pathogens for nutrients. Which of the following would be considered a significant finding in Graves' disease? Option A. Increased TSH levels. B. Antibody to TSHR. Option C. Decreased T3 and T4. And option D. thyroglobulin antibody. So the correct option is B, antibody to TSHR. The DiGeorge anomaly may be characterized by all of the following except option A, autosomal recessive inheritance, B, cardiac abnormalities, C, parathyroid hypoplasia, and option D, decreased number of mature T cells. So the correct option is A, autosomal recessive inheritance. Distribution of the myelin sheath of axon caused by antibodies is characteristic of which disease? Option A, MS, B, MG, option C, Graves' disease, and option D, Goodpasser syndrome. So the correct option is A, MS. Immunologic findings in type 1 diabetes mellitus include all of the following except option A, presence of CD8 T cells and the islets of Langerhans, B, antibody to colloid, option C, antibody to insulin, and option D, antibody to GAD. So the correct option is B, antibody to colloid. Blood was drawn from a 25-year-old woman with suspected SLE, systemic lupus erythematosus. A FNA screen was performed and a speckled pattern resulted. Which of the following actions should be taken next? Option A, report out as diagnostic for SLE. B, report out as drug-induced lupus. And option C, perform an antibody profile. And option D, repeat the test. So the correct option is C, perform an antibody profile. Which of the following is true of MHC HLA class 2 antigens? Option A, they are found on all nucleated cells. B, they are found on B cells and macrophages. C, they all originate at one locus. And option D, they are coded for on chromosome 9. So the correct option is B, they are found on B cells and macrophages. The MCQ molecules are associated with which of the following? Option A, graft rejection, B, autoimmune disease, C, determining to which antigens an individual respond, and option D, all of the above. So the correct option is D. Which would be the best immunogen? Option A, protein with a molecular weight of 2 lakh. Option B, nylon. C, polysaccharide with a molecular weight of 2,50,000. And option D, protein with a molecular weight of 1,75,000. So the correct option is A, protein with a molecular weight of 2 lakh. An individual is recovering from a bacterial infection and tests positive for antibodies to a protein normally found in the cytoplasm of this bacterium. Which of the following statements is true of this situation? Option A, class 1 molecules have presented bacterial antigens to CD8 T cells. Option B, class 1 molecules have presented bacterial antigens to CD4 T cells. Option C, class 2 molecules have presented bacterial antigens to CD4 T cells. So the correct option is C. Which of the following is best describe the role of TAP? Option A, they bind to the class 2 molecules to help block the antigen binding site. Option B, They bind to class 1 protein and proteasomes. Option C. They transport peptides and to the lumen of the endoplasmic reticulum. Option D. They help cleave peptides for the transport of to the endosomes. So the correct option is C. They transport peptides and to the lumen of the endoplasmic reticulum. Measurement of CRP, C-reactive protein levels, can be used for all of the following except option A. Monitoring drug therapy with anti-inflammatory agent. B. Tracking the normal progress of surgery. C. Diagnosis of a specific bacterial infection. And option D. Determining active phases of rheumatoid arthritis. So the correct option is C. Diagnosis of a specific bacterial infection. Skin lactic acid secretion, stomach acidity, and the motion of cilia represent which type of immunity? Option A. Natural. B. Acquired. C. Adaptive. And option D. Auto. So the correct option is A. Natural. Reactions of antigens and antibodies are option A. Non-sensitive. B. Non-specific. C. Highly specific. And option D. Both A and B. So the correct option is C. Highly specific. Which one is a correct statement about the structure of immunoglobulin? Option A. One light chain and two heavy chain. B. Two heavy chains and one light chains. Option C. Two heavy chains and two light chains. And option D. Both A and B. So the correct option is C. Two heavy chains and two light chains. Which of the following sets of cells can present antigen to the helper T cells? Option A. B cell and dendritic cell. B. B cell and cytotoxic cell. Option C. Macrophages and eosinophils. And option D. Neutrophils and plasma cell. So the correct option is A. B cell and dendritic cell. Which of the following systems protect our body against disease causing microbe? Option A. Immune system. B. Digestive system. C. Excretory system. And option D. Respiratory system. So the correct option is A. Immune system. Which of the following immunities is present from birth? Option A. Innate immunity. B. Active immunity. C. Passive immunity. And option D. Acquired immunity. So the correct option is A. Innate immunity. Neutrophils, basophils, lymphocytes, eosinophils and monocytes are examples of this. Option A. Physical barrier. B. Cellular barrier. C. Cytokine barrier. And option D. Physiological barriers. So the correct option is B. Cellular barrier. B cells and T cells are two types of cells involved in this. Option A. Innate immunity. B. Active immunity. C. Passive immunity. And option D. Acquired immunity. So the correct option is D. Acquired immunity. The common disorder caused by a poor immune system include this. Option A. Epidemic diseases. B. Deficiency disease. Option C. Autoimmune disease. And option D. None of the above. So the correct option is A. Epidemic disease. Which of the following statements is true about passive immunity? Option A. This immunity causes reactions. B. This immunity develops immediately. Option C. This immunity lasts only for a few weeks or months. And option D, all of the above. So the correct option is D. Which of the following immunities is obtained during a lifetime? Option A, acute immunity, B, passive immunity, C, innate immunity. So the correct option is A, active immunity. Which of the following cells is involved in humoral immunity? Option A, T cell, B, B cell, C, mast cell, and option D, both T and B cells. So the correct option is B, B cells. Which of the following conveys the longest lasting immunity to an infectious agent? Option A, active immunity, B, passive immunity, C, both A and B, and option D, none of the above. So the correct option is A, active immunity. Skin, body hair, cilia, eyelashes, the respiratory tract, and the gastrointestinal tract are examples of dash. Option A, physical barrier, B, cellular barrier, C, cytokines barrier, and option D, physiological barrier. So the correct option is A, physical barrier. Cells involved in innate immunity are dash. Option A, phagocytes, B, macrophages, C, natural killer cells, and option D, all of the above. So the correct option is D. Patients suffering from Waldenstrom macroglobulin demonstrate excessively increased concentration of the following. Option A, IgG, option B, IgA, and option C, IgM, and option D, IgD. So the correct option is C, IgM. Which of the following immunity is called the first line of defense? Option A, innate immunity, B, active immunity, C, passive immunity, and option D, acquired immunity. So the correct option is A, innate immunity. The immunoglobulin class associated with immediate hypersensitivity or atopic reaction is option A, IgA, B, IgM, C, IgD, and option D, IgE. So the correct option is D, IgE. Which one of the following is the first line of defense? Option A, GIT, B, kidney, C, skin and outer surfaces, and option D, skin inner side. So the correct option is C, skin and outer surfaces. The branch of the biology involved in the study of the immune system in all organisms is called dash. Option A, botany, B, microbiology, C, immunology, and option D, biotechnology. So the correct option is C, immunology. Which of the following cells is involved in cell-mediated immunity? Option A, T cell, B, B cells, option C, mast cell, and option D, both T and B cells. So the correct option is A, T cells. The immunoglobulin class is typically found to be present in saliva, tears, and other secretions. Option A, IgG, B, IgA, option C, IgM, and option D, IgD. So the correct option is B, IgA. Which of the following does not act as a protective barrier for the body surface? Option A, skin, B, mucus, C, gastric acid, and option D, salivary amylase. So the correct option is D, salivary amylase. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल. अगर आपको ये वीडियो पसंद है बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें। Which of the following would support a diagnosis of drug-induced lupus? Option A. Antihistamine antibody. B. Antibodies to Smith antigen. Option C. Presence of RF. And option D. Antibodies to SSA and SSB antigen. So the correct option is A. Antihistamine antibodies. Which of the following white blood cells is capable of further differentiation in the tissues? Option A. Neutrophil. B. Eosinophil. Option C. Basophil. And option D. Monocyte. So the correct option is D. Monocyte. All of the following describe an epitope except option A. Same as an antigenic determinant site. B. Area of an immunogen recognized by T cells. Option C. Consists of sequential amino acid only. And option D. Key portion of the immunogen. So the correct option is C. Consists of sequential amino acid only. Thank you for watching my videos.